Hi, I'm Sarah Newkirk and I'm a first-year Doctor of Physical Therapy student.
And I'm Ken Kiesler and I'm also a first-year Doctor of Physical Therapy student.
As physical therapists, it is our responsibility to maintain and improve the physical well-being of our patients. And as healthcare providers, we are also working on musculoskeletal deficits in patients, and we are working on improving strength, range of motion, stretching, balance, and gait, just to name a few. And in order to do these things, we have to possess skills necessary to assess our patients, interdisciplinary communication, and education skills.
Upon graduation, a student may have the option to continue their education in the form of a residency or fellowship. These are just specialized areas where a student can continue their education. If they don't choose to do so, they will have the opportunity to sit for the national board exam, and once they pass that exam, they will be a licensed physical therapist. Now, it is important to make the point that past generations of physical therapy programs were not doctorate levels. However, today and going forward, all programs are doctorate levels.
Some of the more common conditions that physical therapists treat include musculoskeletal conditions such as range of motion, strength, balance, and gait, and also neurologic conditions such as spinal cord injury, traumatic brain injury, and Parkinson's disease.
Some of the less common conditions that we treat consist of pediatrics, geriatrics, wound care, concussions, lymphedema, and also obesity.
Some of the more commonly known physical therapy settings are inpatient and outpatient settings, and within that includes inpatient settings like hospitals and acute care, and then outpatient orthopedics and outpatient neurologic centers.
Some of the less common areas of practice for physical therapists consider things such as school settings, wellness centers, military bases, and also home health.
Hi, I'm Mallory. I'm a second-year graduate student studying Child and Family Studies.
Hi, I'm Rachel. I'm a second-year grad student also studying Child and Family Studies.
Child life specialists are clinically trained to assess the psychosocial and developmental impact of injury, illness, trauma, and loss. Due to our developmental background, we can provide developmentally appropriate and evidence-based interventions to really minimize the stress and anxiety that's often present in the uncertain nature of the healthcare environment. So we do this in a lot of different ways. We offer a lot of different services in the healthcare setting. One of the first things we do is prepare children for any upcoming procedures by explaining the sensory experiences that they may encounter. We can explain diagnosis in developmentally appropriate terms. We can offer procedural support by offering different tools during procedures like light spinners and bubbles for alternative focus. We can create coping plans and implement different pain management techniques and support children and families through grief and bereavement. We also strive to normalize the hospital environment by creating a sense of familiarity and really focusing on the emotional health of the family so that we can help them through this unique and individual journey that they're on. Child life specialists are governed by the Association of Child Life Professionals, who outline our scope of practice and our core values, and also certify anyone that has the credentials of a certified child life specialist.
To become a certified child life specialist, you can either have a bachelor's or a master's degree. Here at OU, we have two different ways you can get a master's degree. But basically, your bachelor's or your master's degree can be in child and family studies, psychology, human development, things related to that realm. Your classes will focus primarily on development from birth to death. We're going to be also focusing on family studies, theories in development and families, also death and dying, stress and trauma, and also play therapy are the classes that they look for. Then you'll be completing a practicum, which is a shadowing opportunity in a healthcare environment that ranges from 100 to 200 hours. Upon completing your practicum and your coursework, you're going to apply for an internship, which is a rigorous 600-hour position where you'll be working one-on-one with a child life specialist, implementing those interventions and that support for patients and families independently and also with a child life specialist to gain that experience. Once you complete that practicum and that internship, you now can sit for an eligibility assessment, which is completing your coursework through the Association of Child Life Professionals, and then you can sit for a certification exam. Upon completing and passing your certification exam, you can start working in the field. We traditionally work in a healthcare environment. That could be a freestanding children's hospital or a children's hospital within an adult hospital. We can also work in non-traditional settings. that being schools, medical diagnosis camps, hospice centers, palliative care offices, doctor's offices, dental offices, anywhere really where children need support in a healthcare environment, whether that be a traditional hospital or not.